Welcome to Chat with Dr. Kat. This is Dr. Kat. Wonderful to have you today. I am so excited about today. We have an amazing guest today who has just hit the internet by storm with her straight talk, just forward thinking and complete honesty, which is so refreshing. Her name is Daviana Memont, and she is with us today. And before we get started, just remember today is all about no fluff, no judgment, just real talk that leads to real change. Welcome, Daviana.
Hi, thanks for having me.
Thank you for coming. Okay, so let's just jump right into it. Tell me about your history and what has been your journey through your transition.
Through my transition, or do you want me to start like all the way back to like when I was a kid?
Yeah. Let's talk about that.
So grew up, I'm the youngest of five, two older brothers, two older sisters. Right around, I'm guessing, because obviously I don't exactly know, around 6 years old, I kind of knew that like something was different. Mm-hmm. I didn't know what it was. Like I had no idea. So I just continued on with life and let it roll with the punches kind of and see how it went. And as I started to get older, the more I started to realize that like I wanted to wear female clothes. Mm-hmm. Like I was trying on my mom's nylons and skirts and stuff like that. Like, and then as I progressively got older, like I was like ordering my own clothes and wearing them, but behind closed doors. And, I was always taught, I grew up Catholic, went to Sunday school, and it was like, a man's a man, and that's the end of it. So like joined the Marine Corps, got out of the Marine Corps, got heavy into lifting, and I still felt and continued to try on clothes of all sorts and stuff like that. And it was just like I figured like the Marine Corps would like beat it out of me kind of. Mm-hmm. And then getting out of the Marine Corps and hooking up with the gym that I used to go to. And it was like, oh, they're doing strongman. I was like, all right, great. I'll do strongman. And like, I started competing and coaching. And then like, there was a huge influence of steroids. So I was like, great, steroids. I'll do steroids. I'll get more muscles. That'll beat it out of me. And got as big as I could. I got as strong as I could. And it still wasn't enough. Couple of marriages that went good and bad. And then my last marriage, I was like, you know what? I'm just going to tell this person everything. And I did. And she was accepting of it. And then
you told her from the beginning.
Told her right from the beginning. Mm-hmm. And she was accepting of it. She took me out on my first date out in public, dressed as a girl. Like it was great. Like she was really open to the idea. But then when we had a child, she kind of thought like, okay, this is over now. Like you're going to be a man now. And that's it. And there was some other things that we didn't agree on. So that marriage ended. And then 2 years after the marriage, I was like, that's it. I'm living my life. And here I am. That's the very brief, undetailed version.
Okay. So can you tell me a little bit how your family handled you wanting to become a trans woman?
So it's so short and sweet that it's like, there's like no story there. Like I showed a picture to my mother and my father. My mother looked at the picture and she was like, not surprised. And that was it. Like it was done. It was over.
She knew.
There was no more conversation. There was no talk about it. There was nothing. The only person that like I had to talk to about that was like really like lost and kind of like struggled with the idea was my brother, my older brother that was the closest to me in age because like we were inseparable as kids. We did everything together. Mm-hmm. And growing up as adults, like we were always there for each other. Mm-hmm. So like I think he was just kind of like taken back and upset about the fact that like one, I didn't tell him about it, and two, like when it started to become more public and like it was in the news, but like I wasn't out, and like he would talk about how like this is ridiculous and this is pathetic. I'd be like, oh yeah, it's absolutely ridiculous. Yeah, it's oh my God, those people are nuts. But I was just doing it to kind of like fit in because I didn't want to be like, oh no, it's fine, Danny, no big deal. Like I was just like keeping it to myself.
Or even try to explain to him. Maybe they're feeling like it was just joining in with his just not
with
knowing.
Whatever he said, just to kind of like let the subject go away as fast as possible. Sure. So I was like, I don't want to touch on this subject. It needs to disappear. Mm-hmm. Yeah. And so, that was the only person between him. And then I had one best friend that like was like, I'll get you help. Like whatever you need, I'll get you help. And like, we sat and we had a conversation for like 3 hours. And then I asked him afterwards, I said, do I seem any different to you? And he goes, I'm like, besides my appearance. And he's like, no, you're the same person. I said, there you go. I'm like, and now we're fine.
So no issues with friends. Everyone has been accepting, and probably the ones that maybe didn't accept are ones that just need to fall by the wayside anyway. What are your...
Probably. Yeah.
Okay. And your dad?
Like, was just like, I mean, my parents are like late 70s. I think my dad might have hit 80. I don't remember. It's hard to keep track of his age. So like, they're at an age where they just don't care. Like, it's just like, whatever. Like, it's not even like, I'm David, period. Like, I am their son. That's it. And like, it's not a conversation that has to come up or be debated or anything like that. Does that make sense? Like, you know what I mean? It's not like,
yeah, I mean, that's wonderful.
Now, it's not like what I deal with when I talk to other parents and their kids, where it's like, oh my God, this is a big issue. Like, I think it's because they're so much older that you're just like, whatever.
Right.
Like, it doesn't need to be talked about.
Well, that's wonderful. You've had that experience because, as we know, there's so many people, young and old, that just don't have that experience. And they're met with such, confusion, anger, disbelief. Yes, let's take you to the doctor and fix this. So that's wonderful that you've had that experience. And I know that through our conversations, you do some coaching with people that contact you because they're going through it. And, we'll get more into that because there's some specific things, especially with younger kids, that I want to touch on in a little bit. But you have a daughter, so I want to talk about your daughter. And how has she been through this?
So she found out, and I did a whole like 10-minute video on how she found out and how I explained it to her. And I was like shocked as to how well she handled it. And like, she had some like moments where she was just like, I just wish my daddy was normal. And I was like, I know, I understand. And I would have to like explain to her like how much happier I am this way, and like show her how much happier I am, and like just be me. And the more she saw me, the more she realized, like, she's like, you're much happier this way, daddy, to the point where she was like encouraging me to like continue to do it, and throwing away my boy clothes and telling me I can dress like a girl all the time and stuff like that. And like, so once she got involved, as far as knowing about it, I kept her involved with every step of the way. I brought her with me to the surgeon consults. Whenever I had her during my voice therapy, because I did a little bit of voice therapy, she would sit in and she would grab a book, and like, I would read the book to the voice therapists with her sitting in, and like, she would even be like, you can do better than that, daddy. Like, try harder. She was very encouraging. And like, even now, it's just like, she got a little bit bullied at school when it first happened, because she goes to a private Catholic school. And, a lot of the parents kind of took their distance from me, but then they've turned around and come back to where like, I see them all the time, and they're like, how you doing? How's things going? They call me by Daviana. And everybody's nice about it. And like, all the kids, they're just like, she calls me dad, and all the kids are like, oh, there's your dad. Like, they know, so it's like, it definitely, I would say there was an adjustment period, but it didn't last more than a couple months.
That's good.
And she didn't care either. Like, when it first came out, like, her class last year had a secret reader where you could come in as a parent without the kids knowing and read to them.
I love secret reader. Yeah, I remember that.
And she asked me to do it several times, and I just kept on saying, no, I can't do it. I can't do it, because I was afraid for her. And then finally one time she asked me again, and I'm like, honey, are you sure the kids aren't going to bother you? Like, if I come in and read? She goes, daddy, I don't care. She goes, they can say whatever they want. She goes, I want you to read. And I was like, okay. And then like, at that point I reached out to go, and all the spots had been taken already. I was like, all right. But I've been to many school functions, and it's not an issue.
Well, I saw one of your last videos, father-daughter dance, which, that has such a special place in my heart. As I had mentioned to you before when we were talking, that, I ran it for 7 years at my daughter's school, and at my other, when they went into high school, or actually middle school, we had done it. And then of course we went into the pandemic. But so how was that for you? How was the father-daughter dance going?
The father dance was fine. And I wasn't the only woman there either. Like, there was other moms were in there with their kids. So it's like, not every kid has a dad anyway.
Right.
That aspect that's showing up. So the mom shows up, but like, I talked with, I say 5 or 6 different dads that were in her class this year and some from her class last year. Nobody has a problem talking with me or, standing next to me and having a conversation. Like, everything's fine.
I think a big part of that, though, is your confidence level. You're very confident with who you are. It makes a big difference, a very big difference. So I'm glad you had that experience. I'm really glad you had that experience because that's important for you and your daughter to continue to share in that. So that's wonderful. That's wonderful. Okay, so no issues as far as anyone in your life giving you any problems with you being a trans woman?
Not really, no. Nothing that's like, I mean, on social medias, there's a few hateful people that jump in and say stupid comments here and there, but like, I really don't care. And then like, I went through, so before I actually came out and transitioned, like when I didn't have my daughter and before she knew, I was still living my life like as a trans woman, going out in public dressed like almost every time I didn't have her. Mm-hmm. And I spent a lot of time during then without confidence, like mm-hmm. with my head down everywhere I went. And then like if I would just sit like out at dinner or drinks with like some friends, like I'd be looking around, seeing who's staring at me, wondering what they're thinking, what are they saying? And then, something just snapped in my head. It was just like, you're spending all your time looking at them and not enjoying the moment that you're in.
Right.
And the more I started just being me and enjoying my moment and not paying attention to everybody else's moment, it didn't matter because if people were looking at me, it didn't matter if they were looking at me. And now if they're looking at me, they're looking at me in a different way. I think some, but like, it's kind of like if you walk somewhere and you have this meek look about you, people are going to look at you like in this way that like, is going to make you feel like, they're a predator and you're the prey.
Right.
But if you step up and walk with that confidence of like, this is where I belong, people just go along with it. And they think that this is where you belong. It's that whole like fake it till you make it that I had to do with my own confidence to just be like, just go, just walk, just do your thing. Mm-hmm. And let go of this weight on your shoulders of people are staring at you going either like, damn, that's a big bitch, or going, that's a friggin' guy in a dress, mm-hmm. And it's like, right. Either way, they're not wrong. So it's like, whatever, they like own who you are, and that's the end of it.
So also throughout this journey, you went to therapy. How was that therapeutic experience?
So my first therapist, literally, day one affirmed all my feelings right off the bat. And I felt really uncomfortable with it, to the point where I didn't go back to her again. And then my next therapist was a little rougher around the edges. And so we got along real well. She swore like a trucker. She was a no nonsense person. She grew up and lived in a rough part of Boston, and like basically told me like, you better tell the story straight, or like, I'm not dealing with you. Which was great. So like we sat for the first hour and I told her everything that I could think of, and I didn't cut any corners. I didn't sugarcoat anything. And mm-hmm. at the end, she goes, wow. She goes, you really told the truth. And I'm like, yeah. I'm like, what's the point of therapy if you don't tell the truth? I'm like, so there it is. And she's like, all right. She goes, good. And she didn't mention anything about affirming how I felt or anything like that. And then the next sessions, we just kept talking about like childhood, youth, relationships, like injuries, trauma, my military experience, the whole bit. Like we talked about everything that might possibly going on in my head that could have possibly led me to this, and so on and so forth. And it was just like, okay, great. She's actually trying to figure out who I am on the inside, as opposed to just being like, oh, okay, you want to be a female? Great, you're a female, which I loved. I thought that was the best thing ever.
So explain a little bit more to people that may not understand when you said, I went to this first therapist and all she did was affirm. So explain that.
So what it is like, and my second therapist told me that's why she left private practice and went to her own practice, is because the system was telling them, if you have someone come in, you have to affirm them. You have to tell them that you believe that they are transgender, mm-hmm. whether it's male or female. Like you have to tell them, you have to affirm them. So like when I saw that first therapist, she was like, oh, she goes, so you feel like that you're a woman on the inside? And I was like, yeah. And she's like, all right. She goes, we can talk about like, setting you up with the right doctors to get you on hormones and who you need to see for this. Like she went straight to like right into it. Like, let's get you doing this. Whereas my other therapist was like, it was like I was seeing her for like 2 years, I think, before I even started hormones. So and I needed a letter from her to get surgeries, like, and they need to be approved through the insurance to be able to get the surgeries. Like, they needed her signature being like, yes, I believe that this is going to better his life. So, yeah.
That is a big difference. That's a big difference in the process, because I agree, in the beginning, it should just be about getting to know the person and what happened before, what led to this place, what's been there all along. Because if not, that's just kind of hidden landmines that can go off.
And for me, like, I kind of feel like with the therapy that I went through, like, I was able to figure out that, oh, well, this is why I did this at 6 years old. This is why I did this when I was 8 or 9. This is why I did this at 10. This is why I did this at 12. And like, it all kind of made sense. And she helped me make sense of that. Whereas I feel is like a lot of the kids today that I've been talking to their parents and stuff like that, it's more of like, hey, Johnny says he's non-binary, so like, I think I'm trans. And it's like, why? Well, because he says that I like boy stuff, so that way I should be a boy. And it's like, no. And it's like, you need to reintroduce the concept of what a tomboy is to people.
Exactly.
It's like people don't even know what that is anymore. It's like, what's a tomboy? Like, are you serious?
Right. There is. I mean, we are seeing a lot of younger kids going through, and I mean, it's always been, kids will ebb and flow, with different feelings, different emotions, attaching from one group to the other. And sometimes what we're seeing now is parents are just jumping into full acceptance, which can help the child go through the process. However, there's some pitfalls in just accepting and running with the whole thing. And you posted this amazing video, and I want you to talk about that. And I think this is a good spot for it. What are your views about kids going through a transition at a young age?
So the doctors, for instance, like if you were to talk about the medical side of it, if you look at like the information packet that's handed out, they tell you all the benefits that you want to know about the hormones, but they don't tell you the side effects that you're going to have to live with. And then when it comes to kids, the biggest thing is this. It's like, I compare it to like joining the service, drinking alcohol, stuff like that. It's like, and like the parents, like you said, they're so quick to like support them. And so many parents come to me and they're like, I really love my child and I want to be there for him and support him no matter what. And I'm like, what do you mean no matter what? I'm like, you're going to support your kid if they decide to like jump off a cliff? Like, you're going to support your kid if they decide, you know what, I want to identify as a pirate, so I'm going to gouge an eye out and cut off a leg? Like, let's be real here. And then I look at it like, in the state I live in, Massachusetts, you can't rent a car until you're 25 years old.
Right.
You can't own a weapon until you're 21, I think. You can't drink until you're 21. You can't smoke until you're 18. You can't go into a rated R movie till you're 18. You can't drive until you're 16. There's a reason why there's all those age limits, and it's because of the maturity of the person, of the child.
Right.
Why would we take something that is going to be more life-threatening for long-term life, as opposed to, all right, I'm going to go do 4 years in the Marine Corps and get out? Or, I'm going to start smoking cigarettes, or get a tattoo. Like, so many parents are like, there's no way I'll let my kid get a tattoo, not until they moved out of the house. But that same parent will be like, oh, my little Daphne wants to be Derek. So let's get her started on puberty blockers. And I'm like, huh?
Right.
Like, that doesn't make any sense. Like, if at that young age, you're not willing to let your child join the military, own a gun, smoke cigarettes, drink alcohol, and drive a car, then there should be no allowance of any kind of transition. And I don't even think they should be transitioning socially at all. Like, no social transition, no wearing the opposite sex clothes when you go to school, no asking the schools to allow you to go into the opposite sex bathroom. Like, none of that. I don't think it should be a part of any education system whatsoever.
And why do you feel so set on that? I mean, I know you just explained a lot of it, but what is it in your heart? What are your feelings and emotions that go along with a kid that maybe was ebbing and flowing and not sure what was going on, and all of a sudden they find themselves after they've had hormone blockers, and then what? And then what? I mean, some of the things you posted and you talked about, and of course I followed up with and looked at, that there are irreversible damage that's
But let's
caused.
talk about young girls that want to be boys, which, by the way, there's more of that now than there is the other way.
Right.
You have more little girls that want to transition to boys than you have boys that want to transition to girls. So when a little girl takes hormone blockers and then they start her on testosterone, her vocal cords will start to thicken. Now, the larynx of a girl is not as big as the larynx of a boy. Mm-hmm. So now the vocal cords are getting bigger and the larynx is staying the same size. So now they're going to have a sore throat pretty much for the rest of their life, unless they have surgery to reduce their vocal cords, which is going to be painful, and their voice will almost never sound the same anyway. Right. Then you're going to have vaginal dryness. But then with vaginal dryness, it's not just like, oh, it'll start to get wet again. The membranes inside there will dry up completely and not be functional. Mm-hmm. So now you're going to have like almost like the equivalent to like, I would say the equivalent to endometriosis pain at a young age. Mm-hmm. And then you're never going to be able to give birth ever. Mm-hmm. Now, if you're only on hormones for a few months, can this stuff be reversible? Yes. But if you start taking it for a couple of years, the damage is going to be done. And then God forbid you actually cut off your breasts. Mm-hmm. And if you do that, you're generally not going to a gender affirming surgeon. You're just going to a surgeon who removes or attaches breasts. Mm-hmm. And if they don't get all the tissue out and you decide 6 months later that you still want to be a girl, and then you go on with life and your vagina works perfectly and you get pregnant, guess what's going to happen? The little milk fairy is going to show up and you don't have any more tissue. And chances are the glands that were attached to your nipples to allow milk to flow are no longer attached. Mm-hmm. So now you're going to start to develop very hard milk masses inside your breast that are going to be extremely painful. They don't discuss these things with the girls. They don't tell them all these side effects that are possibly going to affect them for the rest of their lives. And they need to. And then on top of that, you look at the prefrontal cortex of the brain and what it's responsible for. It's responsible for making hasty decisions. It's responsible for making reasonable thought. And it's not capable of doing that until the age of like 20 to 25, depending upon the person. It varies. Mm-hmm. So like right off the bat, that's a perfect argument right there to be like, no one's allowed to transition until 25 or older. End of story.
Mm-hmm. It's an interesting thing. We say when you're 18 years old, you're an adult. And for every parent, we know that is not realistic. I mean, just how they are, how they behave, their thought process, they're very, very much stuck in that impulse, or lack of impulse control. And so we see all that. We see it during college as well, making the same decisions. They're living their life, doing everything that they do. Then once they get out of college, they have a couple of years, and then they are adulting. But it's not until then that they're really adulting. So, to make this type of decision. But what you talk about is lacking in social media. We're not seeing that part. And, what's really interesting is part of a conversation you and I had also was that, a lot of things that we see on social media, it may be a select few, but they're loud. They're loud. And
they're loud and replayed over
again with incorrect information. And then what happens is people as a whole start to create a judgment, right, around what they're hearing, which is not necessarily what the community feels like. You've got the trans community that in general don't have a lot of these emotions and feelings and beliefs that are out in our communities. So they make judgment. I mean, I have to say, there's been a few times, actually more than a few times, that I've had different things come up within my practice with different people. And again, it's just lacking knowledge, lacking information. And a lot of it is based on fear. How is this going to somehow now affect my child? How is this going to affect me as a person? And I think it's because a lot of what they see is I need to change as a result of this other person, their other person's choice. So this is why you are refreshing. You are straightforward. and to the point. And this is the other one that I want to lead into, is that you did this one video where you came out with a box of tampons. Okay. And I have to tell you, the first time I watched that, I was in a Trader Joe's parking lot, and I was sitting there and I was meeting a friend. We were going to go shopping, and here you come up, and I am just laughing out loud because it was just so funny the way you presented it. But it's common sense. And I think a lot of what gets out there is that misinformation, or you do get certain people's views, and then people out in the open are like, wait a second, this affects me. I don't like what's being said. So what do you say to that? What do you say to some transgender women that are out there saying that they now have their period?
I basically just tell them to shut up, and then I ignore them. And I tell everybody else, I'm like, just ignore them. They're just a waste of time to even talk to these people. This is what I think of as the difference between, like, when everybody says, like, oh, well, you're transgender, you have a mental illness. And it's like, I understand where you're going with that, but I honestly disagree. Like, I am probably one of the most sane, straightforward, realist type of person you'll ever meet. I think that in the trans community, when you have people that are turning around going, I am a woman, and you have to respect that, those people need more therapy.
Right.
Absolutely. Because you need to be, and I made I made a couple of videos about rules, and I made the last one I made like 6 solid rules. And it was like, one of the rules to be able to transition was like, you have to understand that you are a biological, like whatever your biological sex is, that's what you are and what you always will be. Mm-hmm. And you have to be able to be okay with that. Like, it should be part of it. Like, you need to mentally understand that whether you're transitioning from a woman to a man or a man to a woman, you're always going to be what you were born into. And that's the end of it. Mm-hmm. There's not enough surgeries or hormones to change your DNA, to change your chromosomes, nothing. So accept that mentally, because accepting it mentally shows mental stability. Right. Not accepting it shows mental instability. And to me, that's like, okay, well, you're not mentally stable enough to accept this, like, at all. You need to be able to accept it. And so, like, when people just like, I have, my inbox gets full every day with people saying, hey, I want to get your take on this. And it's like, normally it's like, I've already seen it already. Cause like the videos, I'm like, so I'll just be like, seen it, or like, you know, some of them I'll be like, I've already posted this months ago, like whatever. And it's just, you know, this one woman, trans woman, got in front of a microphone not too long ago outside and was like, she goes, oh yeah, so I'm a trans woman, I actually get periods now. And the guy interviewing her was like, so your uterine lining bleeds every month? Right. And she's like, well, no, funny thing, I don't have a uterus, so that doesn't happen. He goes, yes, so you don't get a period. And she's like, well, no, but I get the emotional ups and downs. And he was like, yeah, I don't think you do either. And like, my first thought was like, okay, I take an estrogen shot and I take progesterone by pill every night. Now, with my use of steroids over the years, I found out and did a lot of testing, being a coach of other athletes, men and women, that used performance enhancing drugs. All medications, to include steroids, work best at microdosing, not at 1 shot a week. Estrogen, just like testosterone, has a half-life, which means if you take a shot on Monday and your estrogen starts to peak on Monday, it slowly decreases until next Monday. Mm-hmm. But that's where your flow comes. And that's why you have transgenders, especially the female to males, that have testosterone coming into their body that they've never had. They never went through puberty. And now all of a sudden they're getting a full shot of testosterone for an average healthy male. That's going to be like, and I can't even imagine what that would be like.
Aggression. Wouldn't there be a lot of aggression?
Unbelievable aggression. And then with that aggression, if they're only doing a shot once a week, they're going to have aggression Monday, Tuesday, Wednesday. Then Thursday, Friday, they'll be normal. Then Saturday, Sunday, they're going to be in tears. Yeah. You know what I mean? And it's just going to be this wave. So like when I went and got my shot, they were like, okay, here, you're going to take 0.03 micrograms or whatever it was once a week. And I was like, can I divide that by 3 and take it 3 times a week? Mm-hmm. And they were like, well, we can't prescribe it that way. I'm like, right. But as long as I take the dose you prescribe in a week, I said, can I do that? And she had to leave and go talk to her boss. And she came back. She goes, yeah. She goes, you can do that, but we can't prescribe it like that. I said, okay. They're like, why would you want to do that? I'm like, do yourself a favor and look up half-lives. I'm like, I'll be more flowing this way. I'll be steady. So like when I started my journey on hormones, I would say for the first like 2 or 3 months getting used to it, like I felt like I was perimenopause. Like I had hot flashes, my
Oh, wow.
earlobes were itchy as hell. Like I had night sweats. It was terrible. I gained like 20 pounds in like 3 weeks because the amount of chocolate I could not prevent myself from consuming. It was ridiculous. And I was like, oh, this is what it feels like to go through menopause. Jesus, this is terrible. Because I've coached numerous women through menopause, but I've never experienced it. And I could only assume this is the closest thing to it.
Wait, can I just say on a side note? So when you and I spoke, again, you impress me with everything you say. The amount of research that you do is unbelievable. And the fact that you take so much care with your health and that 3 times the shots, like, why aren't they thinking about that? But the other part was you coach women physically, right? So you have a gym and you coach women, but just all the things you were talking about menopause. I mean, you know more and said more to me than some of my own doctors have said to me. I mean, just the common sense approach that you take and the knowledge that you take. Like even itchy ears, no one talks about that. Like the fact that you just said that is amazing. And the fact that you know that, I think, is fantastic. And this is why you've been so successful with coaching women, even physically, because you know their bodies. And now you have the experience of it going through it. I don't know. It's just, you have this, you really take the time to learn. I want to say it's impressive. It really is impressive.
Yeah. So like the reason I had that is so, to be honest with you, years ago, I got sick of dealing with clients that just wanted to lose weight.
Right.
And especially honestly, especially females, because females will come to you and be like, I have a wedding in 2 months. I need to drop 20 pounds. And I used to struggle so hard to make that happen. Like, and it would drive me nuts. And then you would get the women that would come to you and you would give them a nutrition plan and you'd be working them out 3 days a week and they're not losing weight. And it wasn't until one day I decided, I'm like, you know what? I was struggling with this client. No matter what I did, she couldn't lose weight. I'm like, I'm going to give her a nutrition plan that will absolutely pack weight on her. Like no questions asked. And she's like, okay. She goes, I got this. I'm going to do it. So she started doing it. Or so she said, and she's like, I'm really starving on this diet plan. And I was just like, okay, here's another one. So then I gave her another diet plan. This is like 2 weeks later that would absolutely make her starving. And she's like, yeah, no, I can't keep up with this food. It's too much. And I was just like, great. I fired her as a client right there on the spot because she was lying. And then I had another client that was complaining about weight loss. And we were outside doing some sled drills. And I walked by her car. And in the backseat of her car was like 4 McDonald's bags. And I was just like, we just got done having a conversation where you said that you were exactly what you ate today. I'm like, there's 4 McDonald's bags in your backseat. Like, what the hell? So once I realized that people just lie, like, consistently lie, don't know how to tell the truth, don't want to tell the truth. It's like, if you don't, I can't help you.
Right.
So I changed up the way I did nutrition with people, where I made them literally start taking pictures of their food, start weighing themselves every day. So like, there was no way that they could get away with it. It was
up
like,
the level of accountability. Yeah.
And, with that, I upped the charge, obviously. But then I also decided, I'm like, I'm done taking clients like that. If someone comes to me and says, I need to lose X amount of pounds by this time, I'm like, go see someone else. Like, I don't like, unless you want to actually make a life change and take the time to retrain your mind to eat healthier, like, I don't want to deal with you, because if you spent years gaining weight, you're going to spend years getting healthy again.
Right.
And you need to focus on that life change. And if you don't, you're screwed. And it's the same. So like with that, I started dealing with people that were difficult. I was like, give me the people that I need to make myself learn. Give me the women with PCOS. Give me the women with endometriosis. Give me the people that have broken their backs. Give me the gentleman who had a brainstem stroke 3 years ago and has been going to Spalding and still can't walk. Give me the people with fighting cancer and leukemia and going in and getting radiation, and teach me, let me find ways to make them stronger quicker so they can handle their treatments. Give me those people, because I want a challenge. Like, because losing weight, it's not mentally easy, but physically it's easy. And if you just do what you're told by a professional, not a nutritionist. Do not go to your doctor and go to a nutritionist as a doctor, especially with the way the food pairing was, because they're just going to get you fatter. Like, to me, I was just like, I would always be like when I go to a professional for anything, I'm always like, well, this is your job, so you tell me. Like, that's it. Like, you're coming to me, you're paying me, then you're gonna listen to what I tell you to do. And I'm gonna do the research to make sure I'm right. And like, the research and treatment for perimenopause has changed drastically over the last 20 years.
Drastically.
But like I was constantly trying to keep up with it, and I still do it. So it's like, I still deal with women today that are going through perimenopause, and like, besides the hormones and besides the body fat gain, the mental instability that comes with it that has to be handled is huge. So yeah. And so it's like, I constantly got to be on my toes, educating myself, and like, being with the partner while she was going through it was a hell of a slap in the face for me, as far as like, oh, this is what
real.
Like.
Right.
Like, okay, like, so it's been, I enjoy researching things that are going to make me better at helping people, because like, outside of joining the Marine Corps because I thought it would like beat this out of me, like, my goal in life was always like, I want to be someone that people come to for help. And when I was thinking about transitioning, I was still married, and I told my wife about it, and she was like, I just want to make sure that Calliope's in therapy. She was 100% supportive of it. But like, I was like, I think if I come out the way I am, I said, I think I'm going to help people. And she laughed at me. She was like, you're not going to help anybody. She goes, you're crazy. I'm like, no, I'm going to help people. I said, and I'm going to save lives with what I do. I'm like, you watch, I guarantee it. And I didn't expect this.
It's
did not expect this.
I'm saying this with, my whole heart. I agree with you. What you're doing, you are saving lives, because you're creating things that are so straightforward and easy to understand. And that's so important, because you've got kids who aren't getting the support at home. They don't know what words to use. They don't know how to explain things to friends. They have no idea what to do. And sometimes it's just literally sending your video. And, I had started to say this earlier. I have sent your video so many times to different people. Just friends that have struggled with the transgender community and understanding it. I've heard comments that they've made. Sometimes they've asked me directly, can you explain this to me? And I'm like, yes, let me explain it to you. Because what they're thinking is not really the reality of it. It's more fear-based on their part and not at a level of acceptance. And, a big part of this show that I'm doing here, these episodes that I'm doing, and it all leads back to acceptance and kindness. And when you know better, you do better. And that's why you impacted me so hard with it, because, in particular, I had a couple of people that were struggling with issues with their kids. And some of them were just friends of their kids. And I sent your video, and I remember this one dad just said, oh, okay. Oh, well, I can get on board with that instantly. And I said, okay, here's your homework for the week. You need to go and watch all of her videos. And, because it's breeding tolerance, it's breeding acceptance, because there's way too much hate that's going on in our world, right now. Absolutely. Too much. Okay, so what I want to do is I want to do a part 2, because I think there's a lot of information here that we have not touched on that I think is so important, especially what's kind of going on in our world. And your opinion is spectacular, so I want everyone to hear it. So right now, let's go ahead and end with this first part. And then what we'll do is we'll go into part 2. And for anyone that is out there and wants more information, you can find Daviana on Instagram, YouTube, everywhere. You can find her. Facebook, everywhere. Reach out. If your children are coming to you with questions and thoughts and feelings, As parents, we're not perfect. We're not going to handle things perfectly, but you do need to get as much knowledge and understanding as possible. And textbook knowledge can only go so far. You need someone with experience, and you need someone who's going to bring it to you in a real way. And those moments can change the trajectory of your child's journey. So take that time, as well as other people in your life, people that you're working with, friends that you have that are going to come to you and saying, this is not who I feel that I've been, and I'm transitioning. Fuel yourself with information so that you can be accepting of other people. So this has been Chat with Dr. Kat. We've had Daviana here, who's been amazing. We are going to go into a part 2, so stay tuned for that. If you have any questions or thoughts, let me know. If you'd like to be a guest on the show, reach out. Have a great rest of your day.